Blood coagulation. Bleeding occurs when blood vessel is injured. It stops by process called hemostasis. Hemostasis is a complex process that involves three major steps, including coagulation. The coagulation is brought by 12 coagulation factor. The coagulation factor, the circulating plasma and tissue surrounding the blood vessel containing 12 coagulation factor. These coagulation factor are various organic compounds, proteins, coenzymes, inorganic elements, calcium. Under normal condition in circulation, these coagulation factor are present in an inactive form, whereas there is injury. These are converted to active form. The 12 blood coagulation factor are indicated by Roman numbers. These are 1. Fibrinogen, 2. Prothrombin, 3. Tissue extract, tissue thromboplastin, 4. Calcium, 5. Proacelerin, liable factor, 6. Combined and factors, 5. 7. Proconvertin stable factor, 8. Anti-hemophilic factor A, anti-hemophilic factor AHF, and 9. Anti-hemophilic factor B, plasma thromboplastin component, Christmas factor, and 10. Stout factor or Prover factor, 11. Plasma thromboplastin antecedent anti-hemophilic factor A factor C, and 12. Contact factor Hegman factor, and 13. Fibrin stabilizing factor Lachiel and factor. The platelets are included in the list of coagulation factor because platelets releases several factors that helps in clotting process. In addition, thromboplastin and thrombin are not included in the list because these are intermediate of coagulation process and not present normally in the body unless bleeding occurs. Normal fresh plasma contains all factors listed above except factor 4, calcium, which is removed by anticoagulant. Mechanism of coagulation. The mechanism of blood coagulation is necessary and significant to understand routine coagulation test. Any of the deficiency of coagulation factor disrupts coagulation process. Intrinsic system, extrinsic system. Intrinsic system, stage 1, 12, 11, 9, 8. Extrinsic system, tissue extract, 3. Plasma thromboplastin and calcium 2+. In intrinsic system, 7 and calcium 2+ in extrinsic system. Gives common pathway 10, 5, calcium 2+. Then it in presence, then end of the stage 1, plasma thromboplastin formed, and then stage 2, prothrombin is converted inactive form is converted to thrombin in active form in presence of calcium 2+ in from plasma thromboplastin. Then thromboplastin is converted. Then stage 3, in stage 3, fibrinogen 1 is in presence and thrombin active form combines to form a soluble fibrin. Then soluble fibrin is converted in presence of factor 12. It forms insoluble fibrin, and insoluble fibrin is converted to formation of fibrin from fibrinogen. Stage 1. The tissue extract or tissue thromboplastin 3 enters the blood vessels through the site of injury and combines with the factor 7 and Ca2+4. This is known as the extrinsic system as the reaction is going on out of the blood vessels. The extrinsic system then joins with the intrinsic system, that is blood vessel. The factors that participate in intrinsic system are all present in the blood circulation. The factors are 12, 11, 9 and 8. Now the extrinsic and intrinsic system join together and follows a common path. These react with the factor 10, 5 and Ca2+ to produce a plasma thromboplastin. The end product of stage 1 is plasma thromboplastin, which enters in stage 2. Any defect in intrinsic system of stage 1 is recognized by activated partial thromboplastin APTT. Stage 2. In stage 2, the prothrombin factor 2 is activated by plasma thromboplastin, which is the end product of stage 1. This results in the formation of active thrombin, which results in the formation of active thrombin. Any defect in the stage 2, that is deficiency of factor 2, will be recognized by prolonged prothrombin time PT. Stage 3. In the final stage of coagulation process, the inactive fibrinogen is activated by the end product of stage 2, that is thrombin. The fibrinogen is first converted in soluble fibrin. The soluble fibrin polymerizes with the help of the factor 13 to form insoluble insoluble fiber in clot. In this way, the formation of a blood clot 12 coagulation factor works in coordination with one another.